As chairman of the Orange County Board of Supervisors, it's my pleasure to welcome you today to another OC press conference. Joined today by my colleague, Vice Chairman Don Wagner, Doug Becht, the Director of Care Coordination, and Matt Bates, Vice President of CityNet. Today we are here to present you with an overview of the results of Orange County's 2022 point-in-time count. As the head of the Office of Care Coordination, Doug Becht and his team organized a point-in-time count and analyzed the numbers found in the report. Matt Bates of CityNet is here to provide you with information on how the count was conducted in the field. Count was possible due to the support of county departments, cities, local law enforcement, nonprofit organizations, and many volunteers who counted nearly 1,000 persons who joined and gave their time, and we must express special thanks to them for doing that. Over 3 days in February, we conducted homeless count in the North, Central, and South Service Planning areas, which is the whole county. As part of the point-in-time count, individuals were asked to complete a survey so we can better address their needs. Of those interviewed, 70% completed the survey, which is up from 60% in the 2019 survey. Compared to the 2019 point-in-time count, the 2022 count shows a decrease in the number of those experiencing homelessness in Orange County based on results for both the unsheltered and the sheltered populations. In 2019, we counted a total of 6,860 individuals experiencing homelessness. And the results of the 2022 point-in-time count show less than a total of 5,718 individuals were experiencing homelessness in Orange County. That is a 16.65 decrease from 2019. Since 2019, the county has made substantial investments addressing homelessness, including navigation centers and housing with wraparound services, and also the kind of thing that we do to provide both physical and mental health services. We even have an ability to help with employment possibilities. We have a special large vehicle that has computers in it, and people can look for jobs and write resumes, which we can't bring out to the navigation centers. So we have a number of beds that are being still created, as well as more affordable housing. That we'll get to at a later time. I think the important thing is, as quick as we can, is to get to the actual numbers. But first, I'd like my colleague, Don Wagner, to say a few words.
Thank you, Mr. Chairman. This is Don Wagner. I'm Vice Chairman of the Board of Supervisors. I also serve on the commission that is addressing homelessness, and so I want to take a moment to thank Chairman Chafee, who is not just chairman of our board, but he is also chairman of that commission. The takeaway today is good news, but that we still have some work to do. I'm the only one standing between you and a deeper dive into those numbers, so I'll get off the stage pretty quickly, but I do want to make sure we don't lose sight of the fact that it is good news today. It is the result of an enormous amount of hard work. I'd love for the Board of Supervisors to be able to take all the credit, but the reality is we have community partners, we have substantial buy-in, we have private partners that have been working extremely hard over the last several years to get us to the position where we are today. And I think it's fair to say uniformly, every one of those folks can pat themselves on the back, but then we'll start rolling up their sleeves to keep doing the work that is getting us where we are, but where we are is not done. We have to keep doing that work. So I'm going to introduce to you now Doug Becht, who is the man with the numbers. He'll explain the methodology, he'll do a deeper dive into the numbers, and I know that's what we're all here for. Thank you to everybody who participated in the point-in-time count. Thank you to everyone who's participated over the last several years in getting us to the place where we are today. Let's keep doing that good work. Mr. Becht?
Good morning, everyone. My name's Doug Becht, and I'm the Director of the Office of Care Coordination. Before I go into the presentation today and provide the results of the 2022 point-in-time count, I'd like to take a few minutes to thank and recognize all those involved in the 8-month effort to plan, execute, and ensure an accurate census of those experiencing homelessness, both sheltered and unsheltered, was conducted. The Office of Care Coordination worked closely with CityNet, the Sheriff's Department, each Orange County City Police Department, many nonprofits and other stakeholders to get the 400-plus maps created, ensuring that the entire county was canvassed as part of the unsheltered count. As the county's project lead, CityNet helped recruit volunteers and local law enforcement to cover almost 1,000 volunteer shifts to survey the entire county over the course of 3 days. The Family Solutions Collaborative, Covenant House California, and other homeless service partners helped survey, collect, and count all those experiencing unsheltered homelessness, including subpopulation-focused efforts, recognizing that not all segments of the population experiencing homelessness do so in the same manner. 211 Orange County coordinated with over 100 emergency shelters and transitional housing programs operated by 35 organizations to coordinate and facilitate a count of all persons experiencing homelessness in a shelter on the night of February 21st. I'd also like to thank the Commission to End Homelessness and the Orange County Continuum of Care Board through their support in the planning process and ongoing involvement in addressing homelessness in Orange County. Finally, I want to recognize our partners at the Hub for Urban Initiative and the OC Public Works charged with compiling all of the surveys and completing the required data analysis to give us the results and information we will be reviewing today. To further provide context to the 2022 point-in-time count effort, I'd like to note that the U.S. Department of Housing and Urban Development requires that all continuums of care jurisdictions across the nation complete a biannual unsheltered count and an annual sheltered count of all people experiencing homelessness in the community on a single night during the last 10 days of January. Due to the COVID-19 pandemic, the majority of COCs in the nation did not conduct a count in 2021. And in 2022, the Orange County COC was among several COCs in California that was approved by HUD to reschedule their 2022 point-in-time count to the last 10 days of February due to the impact of COVID-19 and in an effort to safeguard the health of volunteers and the vulnerable people experiencing homelessness. The County of Orange and the Orange County COC conducted the sheltered count the night of Monday, February 21st, 2022. Emergency shelters and transitional housing programs collected participant-level demographic information from individuals and families staying the night in each of their programs. The 2022 unsheltered count process took place over 3 days, from Tuesday, February 22nd through Thursday, February 24th, to ensure the 800 square mile Orange County jurisdiction was canvassed effectively. This year's count was conducted using nearly identical methodology utilized during the 2019 count. This not only allows us to comfortably compare the data between the two counts, but contributes to the validation of this year's results. As we did in 2019, we spent months working with homeless outreach providers and local law enforcement in the development of the maps used to conduct the unsheltered count. This process helped ensure that each volunteer group knew where to survey, ensuring the greatest likelihood that each person experiencing homelessness was counted. Additionally, the survey incorporated the continued use of the unique identifier, allowing use to conduct the point-in-time count over multiple days and ensuring the canvassing of the entire county at least twice, while having a mechanism to ensure that we were not double counting people. Finally, the continued use of the Survey 123 app and ArcGIS smartphone app allowed us to monitor where people were being surveyed in real time, giving us the ability to go immediately back to any location where it appeared that there might have been an undercount and ensure that every person was counted. Okay, so let's go to the data. Let's see. We're just going to take a pause 1 second to get the data up on the screen. All right, thank you. So in 2022, we counted 5,718 people experiencing homelessness. As the chairman said, this is a 16.6% reduction from the 6,680 people counted in 2019. We're encouraged by this reduction, but understand that we still have plenty of work in front of us. We believe that this reduction is representative of not only the increased regional coordination of services over the last 3 years, but the significant investment and resources that were dedicated throughout our system to address these issues. For example, in homelessness prevention, we have seen over $250 million of emergency rental assistance provided to Orange County residents at risk of eviction and homelessness. The counties, cities, and local law enforcement have dedicated more staff and resources to engage folks living on the street to help connect them to housing. We've seen a significant increase in investment in shelter bed capacity to ensure that less and less people will be experiencing unsheltered homelessness. And finally, we've seen an increase in permanent supportive housing and housing choice vouchers dedicated to this specific group. The overall reduction can be seen across the entire county in all 3 service planning areas, each seeing a double-digit percentage drop. The North Spa's 2,419 people that were counted represents a 12.5% decrease from 2019. In the Central Spa, the 2,714 people counted represent an 18.6% reduction in their overall count. Finally, in the South Spa, the 585 people counted represent a 23.3% reduction. This shows that we are truly seeing a county-wide reduction and not just significant reductions isolated to 1 or 2 geographic areas. As we break down the results between the unsheltered and sheltered numbers, we can see a 22.8% reduction down to 3,057 compared to the 3,096 people in 2019 of people experiencing unsheltered homelessness in Orange County. Again, we see double-digit percentage dips in each service planning area, down 30% in the north, down 16.7% in the central, and 21.6% in the south. We believe this is another example of where we see the impact of increased shelter capacity and permanent housing opportunities show their influence. We're also seeing encouraging numbers among veterans, transition-age youth, and seniors experiencing unsheltered homelessness, with each subpopulation experiencing their own double-digit percentage decrease since 2019. Veterans on the street decreased from 212 in 2019 to 145 this year, representing a 32% decrease in unsheltered veterans. For transition-age youth, those ages 18 to 24, we see a 29% decrease to 109 youth experiencing unsheltered homelessness. And for seniors, those ages 62 and older, we see a decrease by 29% to a total of 300. For our shelter results, we count 2,661 people, representing an 8.2% reduction. We believe COVID and the reduced capacity that most, if not all, shelters were operating under during the night of the count to adhere to guidance from the CDC, state, and county public health offices around social distancing played a significant role in this reduced number. Over the last 3 years, the county, cities, and provider community have invested significantly in shelter and have helped increase our overall bed capacity. So we anticipate that we may see a significant change or fluctuation in these numbers in our next count. As I transition to look at additional subpopulations and reported disabling condition results, we see a significant trend about the condition of people who are currently experiencing homelessness. The data tells us that people experiencing homelessness during this count compared to 2019 are more likely to be over 62, are more likely to be experiencing chronic homelessness, and are reporting that they are experiencing disabling conditions at a greater rate as well. Overall, the 718 people we reported being at least 62 years or older represents a 6% increase from 2019. When it comes to experiencing chronic homelessness and disabling conditions, we saw a greater percentage of people experiencing unsheltered homelessness reporting these conditions in every category, except people living with HIV and AIDS. We saw a 3% increase in those reporting chronic homelessness, 7.5% increase in respondents reporting substance use issues, a 1% increase for those reporting a physical disability, 2.5% increase for those reporting a mental health issue, and a 0.25% increase for those reporting a developmental delay, and also a 0.25% increase for those reporting to be victims of domestic violence. This trend tells us that people experiencing homelessness are doing so with a greater complexity of needs, and that our system needs to continue to evolve to be better equipped to address those needs. I anticipate that this to be a continued focus of the Commission to End Homelessness and the Continuum of Care Board, ensuring that policies and funding are geared towards not only connecting people to services and housing they need, but also providing these people with greater assistance in navigating and coordinating our service system. Lastly, I will present on the results related to household composition and specifically the number of families. Households, meaning households with at least one minor child experiencing homelessness. This year, the overall number of 389 families experiencing homelessness represents a 16.5% reduction since 2019. We see this reduction in both unsheltered and sheltered families. In regard to families that are experiencing unsheltered homelessness, we have seen a 14.6% reduction. And I think especially worth noting is that within that group, we also see a 50.4% reduction in children experiencing unsheltered homelessness. In terms of sheltered numbers, we see a 17.1% reduction to 295 families experiencing sheltered homelessness in Orange County. In the last 3 years, our family homeless service system has evolved. One example of this was the creation of a shelter bed management system, meaning that there's a sophisticated system-wide mechanism that ensures that families with the most need get shelter and that vacancies, when they open up in the system, are quickly filled with another family that is in need. In closing, I'll reiterate that we are encouraged by the results of the 2022 point-in-time count and believe that it represents the significant resources, funding, and efforts that have been brought on board in the last 3 years. But we also understand that there is plenty of work in front of us and hope that these results are a call to action. We look forward to working with the Commission to End Homelessness, the Orange County Continuum of Care, our city partners, our provider partners, and other stakeholders to use these results to continue to better shape our system to assist those experiencing and are at risk of homelessness. With that being said, this infographic that you're seeing here on the screen will be available on our website. I'll give that website to you now. It's bit.ly/2022 PITOC. I'll repeat that again. It's bit.ly/2022 PIT, point in time, OC. And also feel free to reach out to Molly Nicholson, our county's PIO, for further information. With that being said, I'd like to welcome Matt Bates, the Vice President of CityNet, to the podium.
Thank you, Doug, and good morning, everyone. As Doug mentioned, I'm Matt Bates. I'm the Vice President for CityNet. We're a homeless services nonprofit agency that was contracted by the County of Orange to conduct the unsheltered homelessness count in 2019 and also here in 2022. I just want to share a few brief comments about the process of the data collection, and then I'll turn it back over to Chairman Chafee for questions and answers. As has been mentioned, the data collection that took place in late February was the culmination of months of work that took place before then, where our staff partnered with representatives from all 34 cities in the county, plus the county for county unincorporated areas, to create maps where homeless neighbors were likely to be found unsheltered. These maps, and there were over 400 of these that were created, we had a leg up because we had existing maps from 2019, but it was important to us that, given the dynamic nature of unsheltered homelessness, that we had as accurate maps as possible so that when we sent volunteers out on the days of the count, they could be as efficient as they possibly could in engaging homeless neighbors. So we worked with nonprofit agencies from within the continuum of care, with city staff, with county outreach agencies, with local law enforcement in all 34 cities to create and to monitor these maps so that on the days of the count, we handed them over to volunteers who could go out and do the data collection and do it in a way that was going to be effective and efficient. And those volunteers went out and again, has been mentioned, we went to the maps at least twice during each shift. The spots within the maps that were the highest density or expected highest density of homeless neighbors, some of those we went back 3 and even 4 times within that shift to try and be as thorough as we possibly could. We utilized the unique identifier, as Doug mentioned, and so we could ensure that we could eliminate the duplications that way. But the point is that we were as confident as we could be that all across the county we were being as thorough as we possibly could. The volunteers that came back were happy to report that there was 0 safety incidents. So that's always a concern when you're sending volunteers out into the field. In many cases, areas that it's dark early in the morning and late at night, and places that are outside the public eye. But there were 0 incidents from public safety. It was also important to us to conduct this count safety from a public health standpoint. So if you remember back in January, we were in the middle of the Omicron variant of COVID-19. So all the volunteers that participated in this event had to show proof of vaccination and booster status, or they had to show proof of a negative test. And we're proud to report that there were no public health reports neither among the volunteers nor among the homeless neighbors that were being surveyed. So we conducted thousands of these interviews, and we did it in a way that was safe and effective, and we're very pleased with that. The final thing I would just say is that the feedback that we got from the volunteers was also important and enlightening in that very, very common thread was a sense of deeper understanding and empathy towards the neighbors that are living amongst us unsheltered. Even those volunteers that are willing to come out early morning or late night to participate in something like this, generally they have a heart for homelessness and they have a sense of understanding of the realities of homelessness in Orange County. But even so, they went to areas and they engaged in conversations through the course of the survey that were enlightening to them, and they reported a deeper level of understanding and of empathy of those that are experiencing the harsh realities of living unsheltered in the County of Orange. And that's important to us as well. It's not something that's necessarily reflected in the reports, but long-term, as we use this data to try and create better and more interventions, including permanent supportive housing, we're going to need partners all across the county, not only city and county agencies and nonprofit agencies from within the continuum of care, but just everyday citizens, the type of people who volunteered for this event, to speak up and to speak out for those interventions, including permanent supportive housing, to be located in their communities. And so we're hoping to win over hearts and minds through this process, and the feedback that we got from the volunteers was consistently positive in that way. So with that, I will conclude my remarks and yield the podium back to Chairman Chafee for questions and answering.
Thank you, Matt. providing insights into CityNet's contributions towards the 2022 point-in-time count. I especially appreciate the remarks you made about the volunteers that were there and how they took to heart what they're doing. I think that will have impact as we go forward. On behalf of the Board of Supervisors, speaking of volunteers, I want to thank all of them who volunteered for the 2022 point-in-time count, and also CityNet and the Office of Care Coordination who facilitated the count to make it possible. Without their commitment and guidance, this would not have been possible. The point-in-time count and emergency shelters compose only a portion of the system of care for individuals experiencing homelessness in Orange County. One of the I'm going to call it a clog point in our shelter system is not having enough places for the next step. We have people who are ready to leave the shelter, but we don't have a place to put them. We don't have the housing they need. We're working on that very vigorously. For example, we have a commitment to create 2,700 units of permanent supportive housing units by 2025. And to facilitate that, in 2019, we formed the Orange County Housing Finance Trust, which is composed of the county, and currently some 23 of our cities have joined in that effort. Since the formation, we have been able to create 13 projects which are funded and ready for construction or already constructed. That's some 901 units. We have other things happening. I think we will, I feel very optimistic, meet our goal by 2025. I'd like to call attention to the $30 million funding ask we're making of our friends in Sacramento. A bill is being sponsored by Assemblyman Tom Daly. I thank him for his efforts. And as a sign of unanimous support, every assembly member and state senator from Orange County has signed a funding request letter. If we have this grant, that will help us fund another 900 units. I think not only do we want to take care of our homeless population, but I think one of the keys to ending homelessness is prevention. We need to have those that are at risk of homelessness, they need to have a chance to find shelter that they can afford. So we'll continue to work toward this goal. There are other things we're doing. I would take pride in announcing the street medicine initiative that Cal Optima, our Orange County Social Service Department, Orange County Health Care Agency, combined together. We're going to go out on the street with appropriate resources to take care of our homeless population where they are. That will be a way, we hope, of making their well-being while they may be waiting for shelter, or if they don't want shelter, we can take care of them anyway. So at this time, I'd like to provide our media with an opportunity to ask questions. I would ask the operator, please open the media call-in line.
Thank you. Ladies and gentlemen, if you would like to ask a question, you may press 1, then 0 on your telephone keypad. You will hear acknowledgement that your line has been placed in queue. We do ask that you please limit yourself to one question, and for any follow-up questions, you will need to queue up again. We also please ask that you do not use your speakerphone when you ask your question. Please use your earbuds or handheld. And our first question goes to Spencer Custodio with Voice of OC. Please go ahead.
Hi, thanks for taking our questions. Always appreciated as usual. Mine centers on the Sacramento proposal from Gavin Newsom, sponsored by State Senator Tom Umberg on Care Court. I understand, reading through the bill, the proposed legislation right now, it would offer a way for court-ordered mental health services and other services. The state expects to throw some kind of money into that. But I'm wondering, what does the county kind of make of this proposal? Do you see that as a viable way to help kind of alleviate a lot of the issues you're seeing out there as far as the homeless people are experiencing? And, what kind of difficulties might Orange County face running into to set up like a revamped mental health program and then find places for, the people that are in care court where they would go for the next year or so, depending on the length of treatment ordered by a judge? Thank you.
Well, thank you for that question. Actually, we're several years ahead of that proposal. We have our Be Well mental health facility, which is expanding with another campus. We have, for example, our our cooperative court system, which does many of the things the governor hopes to do. We do not do that with a compulsory system. There are plenty of people that want the help, and it's more than just homeless people that need the help. The court system does have also a homeless court, so I see the governor's proposal, which mainly is taking a step beyond to those that are severely mentally ill. And there's some civil rights issues there, which are very serious. But the issue there, if that is resolved, I feel will fit seamlessly into the system we already have. Thank you.
And next we have a question from Nick Gerda with the Voice of OC. Please go ahead.
Hi, everyone. Thank you again for taking questions. I had a few questions. First, I was curious the number of counters for this year's point-in-time count compared with the previous count in 2019. Second, how confident are you that the reduction in the count is real as opposed to homeless people being harder to find, or that people previously may have been counted twice in prior counts that did not have these newer methods to avoid duplication? Third, wondering how this drop
Nick,
in
is it
numbers...
possible if we can limit it to one question per time? Because as you can imagine, it's difficult to make sure we answer it. We can go back in queue. So what was your first question, please?
Can I go back later and ask the rest?
Yes. Obviously, we have time to go ahead and answer questions. So what was your first question, Nick?
Yeah, it was on the number of counters for this year compared with 2019, and how confident that the count is real as opposed to duplication in prior counts, and most people being harder to find now.
For that, I'm going to turn that back over to Doug Becht, and if our city net person would also like to talk about in field, how they were very careful to go out several times if needed to be sure they got an accurate count, please.
So thank you for the question. So this year we did have, the way that we look since both in 2019 and 2022, we did a count over several shifts. We look at volunteer shifts, understanding that some people volunteer more than once. And we saw a slight reduction. We were a little bit over 1,000 folks or volunteer shifts that were filled in 2019. We're looking at just under 1,000, around 980 volunteer shifts that were filled in 2022. That number, obviously, those volunteer shifts are incredibly important. That difference we don't believe was significant, and the reason we don't believe it was significant is because we were able to cover the same amount of maps and the same geographic area over, not only cover it, but cover it twice, just as we did in 2019 as well. In terms of the unique, making sure that we are not double counting folks, we used the same unique identifier that we used in 2019. It's essentially created through a handful of the answers that someone provides during their survey interaction that allows us to feel very comfortable that as we process the data, that any duplications will be pulled out of it. So I think the real message, the most important message I'd like you all to hear is that this was an identical process to 2019. So, yeah.
Is there anything you want to add, Matt? Okay. Next, if we have a question actually in the audience here.
I'm Alicia Robinson with Orange County Register. Thanks for taking questions. I did want to ask, the number of sheltered people went down in this count in spite of all the many, many beds that the county has added. And I understand that capacity was limited in some of the shelters because of COVID, but can you go a little deeper and explain how we should interpret that number being lower than it was in 2019?
Doug.
Sure. So, yeah, as we look at the number in 2019, obviously that's pre-COVID. And as I mentioned previously in my remarks, we do an unsheltered count. We're required to do an unsheltered count each year. So we actually have comparable data from previous years. And essentially, we saw a reduction once COVID, in the inception of COVID. In 2021, we saw a little under 2,500 people in our shelter system, and now in 2022, we see the 2661 number. The best way to interpret it is really that this is COVID related. For example, our county-operated shelters like Yale was operating at almost 50%, 50% capacity on the night. So that shelter has a 425 bed capacity. We have been operating, or we're operating on that night at a capacity of 250. So right there, you're starting to see reductions. So I think it'll be very interesting to see as we increase capacity in the shelters, the effect that it not only has on the sheltered number, but also the effect it's hopefully will have on the unsheltered number as well.
May we have the next question, please?
And we'll go to the line of Norberto Santana with the Voice of OC. Please go ahead.
Yeah, since we're limited to one question, which I think I can tell it's not on the Facebook page at all, so you can't see what the members of the press are asking. I'll just ask the one.
We were having technical
I wonder
difficulties,
about the
Norberto. We're working on it. Thank you.
Sure. Again, I do appreciate you at least taking phone calls on the call, taking press calls on the phone. I'll just ask the one that we're required, that we're allowed to ask, which is, I guess I have questions about the accuracy of the numbers. For example, we saw that homeless deaths are up in recent years. So how is it that the homeless population is down, but homeless deaths are up? So is it less people, but they're more sick? And I'd love to ask again, where do you count? Are you just going to shelters? It sounds like you just said that you went to shelters, and maybe if the shelter capacity was down, then your numbers might be artificially low. So I'm just curious again, just to restate it, if the homeless deaths are up, what does that tell us? Whether these numbers are bad or whether the people are getting sicker? And also, how do you count? Are you going specifically per spa area to encampments, or are we just going to shelters? Thank you.
Well, Mr. Beck, I think you answered some of that with the previous question. If anything you'd like to add?
We are aware of the homeless deaths and number increasing year to year, and that is something that we're very interested in addressing. But I don't know if there is a fair comparison to be made between that number and a point-in-time count census of individuals or people experiencing homelessness in Orange County. As I mentioned in my presentation, a point-in-time count consists of two separate counts: a census of those experiencing sheltered homelessness, meaning people living in shelters on the night of the point-in-time count. We work with each shelter and transitional housing provider in the county to collect that data. In terms of the unsheltered number, we spend months working with outreach teams and with local law enforcement and other stakeholders to ensure that when our surveyors go out the night of the count, that they're not only going out to the street level locations, but they're canvassing everywhere we know to have people experiencing homelessness in a specific geographic area, and that includes going out into the field to encampments.
May we have the next question, please?
And ladies and gentlemen, if you have any more questions, you may press 10 on your telephone keypad. At this time, we have no further phone line questions.
Well, I'd like to thank all of those press members that are asking questions. I'd just like to mention a couple of things that we have done since 2019. Some questions were about the shelters. Since 2019, for example, we've opened navigation centers in both Buena Park and Placentia, some 250 beds. The county provides $1.25 million a year to help them run. I'm very proud of the 50 unit Veterans Village in Placentia that has opened. And of course, our Yale Navigation Center opened since 2019 and has 425 beds.
Chairman, we have one more question in the queue.
Okay.
AT&T operator, can you please go back into the queue?
Yes, we'll go back to Nick Gerda. Please go ahead.
Thank you.
Thank you, and thank you, Molly. I appreciate it. So the question I had was, the survey found about 30% of unsheltered people had mental health issues, and 40% had drug and alcohol use issues. There was testimony at a county hearing a few weeks ago about barriers in people accessing particularly drug treatment services. People sometimes have to wait 2 weeks before they're accepted in. It's seen as a missed opportunity. So I was curious if the point-in-time count asked people what kinds of barriers they may be facing in getting addiction and mental health treatment, maybe how many people would accept services if they were offered, and what you found.
I'm not sure that information was entirely accurate. That's one reason we're doing a street medicine starting up. And I don't know why 2 weeks is involved there. We have services that are available when requested. I'd kind of like to highlight one other thing in Anaheim, and shouts out to the city of Anaheim and also the Salvation Army, which they have a comprehensive center. Besides having a low barrier emergency center of 325 beds, they're also building 72 supportive housing apartments. They have on-site medical and dental care. And they also have, to partially answer your question, 175-bed drug and alcohol rehabilitation center. I think it's somewhat the education, getting the homeless population to know these services are available. We do have our Be Well Center. We don't turn anyone away, whether they have the ability to insure or not. And that includes our homeless population. So I don't understand the 2-week gap. There may be some experience with that. I wasn't at that seminar when that was said. I don't think I agree with that. So that's really a question kind of beyond our homeless count. But we are doing our very best to provide those treatments. And I know Cal Optima, for one, is very much so expanding its services. We are moving forward to see if we can't address our homeless population. They are eligible, as far as I know, most of them, and then trying to get them those kinds of services. So I don't know if I answered your question, but I'm not sure I agree with everything that was in the premise of that question. Any more questions?
AT&T operator, are there any
Mr.
more
Gerda,
questions?
There is. We'll move on to line of Norberto Santana. One moment, please. Go ahead.
Yeah, I appreciate you allowing follow-ups. I was hoping that maybe you could break down the numbers then in the how many people were in shelters, how many people were in encampments. Did you see a growth in encampments, and can you compare encampments and shelters per spa area? And again, just speak a little bit that the survey was done during a surge. So how might it have impacted your survey? And again, thanks again for taking follow-ups.
Well, Mr. Becht?
So the data that's we're presenting today and that we're making available at noon is a subset of the information that we've collected. It's as you may remember, back in 2019, in the summer, we provided a full comprehensive report on the entire data set. Encampment breakdown information would be something that we cannot report today and will potentially be available in that larger subset of data that we'll be releasing probably in August. In terms of the effects on the surge, all that I could say, and I don't want to sound redundant, but we canvassed the entire county over 2 times, exactly the same way we did in 2019 before the count. So we surveyed the shelters the same way we did in 2019. So I don't think the methodology, I feel strong standing behind the methodology that it was not affected by COVID-19 or the surge that we experienced.
Are there any more questions, including follow-up? Please go ahead.
Yes, we go back to the line of Norberto Santana. Please go ahead.
Yeah, I realize that you said you don't have these numbers on encampments. It's kind of an important number to have if you're saying that homelessness is down overall. I guess I'll just leave with this last question. What kind of policy adjustments would you suggest based on these numbers? More targeting of encampments? We're seeing less people in shelters. But what's the takeaway from these numbers, other than obviously you're doing a great job and you've done such a great job that homelessness is down by 20%? And again, I appreciate you allowing the follow-ups.
Well, my takeaway is we've got a lot more work to do. We particularly need to focus on the mental health and substance use disorders, because I think that's a major reason people stay on the streets. Some of them don't want to go into shelters because they have rules there. And so that's why, in part, we're doing the street medicine initiative that is going to be happening soon, if it's not already. It's very close to doing that. I think, Mr. Becht, if you have any comments.
Yeah, thank you, Chairman. So as I mentioned in the presentation, one of the trends we are seeing is that the individual or the people that are experiencing homelessness compared to 2019 are, on average, older, and coming to us with more disabling conditions and needs. So, for us, we're reporting out this data today. We're excited to work through our commission, through our COC, through our community to dive even deeper into these results and help us continue to shape our system. So I think overall we realize that we are seeing a more vulnerable population, and we need to make sure as we work as a county and as COC and as a community that our system is being shaped in that direction.
And we have a question from Nick Gerda. Please go ahead.
Hi, thank you. Just wanted to clarify that the testimony I was referencing about the 2-week wait was from the chair of the County Behavioral Health Board, Matt Holzman, at the county hearing on fentanyl back in March. And he said, quote, "We have to have better treatment on demand. When an individual with addiction is ready to go, there has to be a place for them to go. They can't wait 2 weeks, otherwise the moment is lost," end quote. So again, just wanted to ask, perhaps Doug, you may know, if the point-in-time count asked folks if they would accept treatment if offered, any kind of barriers they may be facing to get a better handle on that, and what you found.
Well, let's the survey may answer that.
I appreciate the question. The survey, which including this area, has very specific guidelines required by HUD in terms of asking people about their reported disabling conditions. So we don't go further in the survey with that. I'd also like to mention how, one of the things we've heard over in 2019 and in 2022 is that the survey we ask, and we collect a lot of data in it, and we're really proud of that, it requires a 20 to 25-minute interaction with the individual you're surveying. So we really value and prioritize the information we're asking. And the other thing I'd say is that the point-in-time count is exactly that. It's a point in time, and our system collects both our homeless service system and our behavioral health system, collect data in many different ways as well. So I don't want to give the impression that this is the only way we're able to measure the needs or help direct us around developing policy and strategy for these people.
I might just add one more comment. When a homeless person comes into a navigation center, we do an individual assessment. What are their needs? Are there mental health issues? Are there substance use issues? Are there physical issues? What do they need to get them out of the shelter back into the society? Does that need job training? All those sorts of things. With our street medicine initiative, that will enable us now to do individual assessments of people left on the street. I think that will expand how our ability is to care for them, whether they're in shelter or not. And with that, I'd like to thank everyone for their great work, and thank you, members of the press, for your questions. This is the end of the press conference. Thank you.